14. Ambulatory. Able to walk. Antero-posterior. Direction of X-ray beam from front to back. Artifacts. Substances or structures not naturally present but of which an authentic image appears on an image. Axial projection. Any projection not at right angles to the long axis of an anatomic structure. Empathy. Recognition of and entering into the feelings of another person. Flexion. Act of bending or condition of being bent. Geriatric. Pertaining to the treatment of the aged. Immobilization. Act of rendering immovable. Neonates. Newborn infants. Pediatric. Pertaining to the branch of medicine that treats children. Plantar. Surface sole of the foot. Rapport. Relation of harmony and accord between two persons. Restraint. Hindrance of an action, movement. Trauma. Wound or injury. One of the many factors that affect diagnostic quality is motion. The motion of the subject does not have to be considerable or exaggerated to affect the procedure. Another important factor affecting diagnostic information is inaccuracy when positioning the patient during an examination. Use of positioning aids such as sponges or supports enables the radiologic and imaging sciences professional to position the patient accurately. At the same time, this support of the patient significantly lessens the possibility of motion. Immobilization techniques cover a wide range of applications, from minimal to highly sophisticated. The simplest techniques involve the use of a positioning sponge to support the anatomic area of interest or gently laying a sandbag across a patient's forearm to minimize shaking caused by patient anxiety. More complex techniques might involve completely wrapping an infant or small child in a sheet, often referred to as a mummy wrap or bunny method, or securing a trauma patient to a backboard to facilitate transport of the patient to the emergency department and minimize the possibility of more severe complications, such as spinal cord damage, during the transport process. In the latter case, the radiologic and imaging sciences professional has not applied the immobilization device but must recognize the importance of the device and be able to use it to the best advantage. Voluntary movement can be controlled by the patient and most often occurs as a result of inadequate communication by the radiologic and imaging sciences professional. Involuntary movement is the result of many contributing factors, for example, examination room temperature, medication, movement disorders, post-traumatic shock, and cannot be controlled by the patient. To minimize the radiation dose to the patient, performing the procedure correctly the first time is important. One of the most effective means of reducing motion on the part of the patient is also one of the simplest is communication. The most important communication is between the technologist and patient. Rapport is a relation of harmony and accord between two persons. While obtaining the history, the radiologic and imaging sciences professional has the opportunity to display empathy, respect, and concern for the patient as a person, as well as to ascertain the clinical facts behind the examination. Any explanation of a procedure generally need not be highly technical or filled with professional jargon. Positioning sponges allow for increased accuracy in positioning by supporting the patient or anatomic area of interest in the correct position. When performing magnetic resonance imaging, MRI, examinations, positioning sponges are used to ensure that the patient fits snugly in the MRI coil, reducing the chance of patient movement while scanning. Stability bars are located on most upright Bucky units. The purpose is twofold: to move the patient's arms above their head and out of the area of interest as well as providing stability and steadiness. The stability bar is adjustable and can be used while the patient is standing or sitting for examinations at the upright Bucky. A good example of the use of Velcro straps is provided by an upright lateral chest position. Straps across the upper portion of the patient's chest can help the patient hold still and also provides a sense of security. Holding the arms up out of the way when positioning for a lateral chest radiograph raises the center of balance and can cause slight swaying even in the steadiest subject, so straps can counter this tendency to sway. An axial projection of the calcaneus requires extreme dorsiflexion of the ankle to produce an optimally diagnostic image. The use of the strap beneath the plantar surface of the foot allows the patient to maintain the extreme flexion required and at the same time reduces the possibility of motion that may result from maintaining an uncomfortable position. Velcro straps are also used in advanced imaging modalities such as MRI and computed tomography. Velcro straps can be used in MRI to keep imaging coils secure. Velcro strap restraints are designed to be attached easily to the imaging table. These types of restraints include two brackets that mount to each side of the table with a strap that is adjustable for any size patient. It can be adjusted to cover any part of the body, such as the chest, abdomen, or legs. This is often utilized in cardiovascular interventional imaging. These restraints can also be used for compression. Tightening the strap a little further applies gentle pressure to the abdomen to enhance diagnostic information in certain procedures. By themselves or in combination with positioning sponges, sandbags are extremely helpful in reducing voluntary motion. Sandbags cannot be placed in such a way that diagnostic information is obscured within the anatomic area of interest. Head clamps are designed strictly for use in positioning various projections of the skull. Head clamps serve more as positioning aids than as immobilization devices. The radiologic and imaging sciences professional must be familiar with the various types of traction and immobilization techniques and devices used by emergency medical personnel. This familiarity must include knowledge of which devices are radiolucent, which must be left in place for initial examinations, and when these devices can safely be removed for more detailed procedures. A cervical collar is designed to place traction on the cervical spine to prevent further life-threatening movement in this vital area. The cross-table lateral, antero-posterior, AP, and AP open-mouth radiographic positions may be used to evaluate the cervical spine during a cervical trauma examination. After evaluating the images, the attending physician or neurosurgeon can determine the next step in treatment. All projections can be produced with the cervical collar in place. If a head is immobilized, the tech must be able to manipulate the radiographic equipment to compensate for the patient's lack of mobility. A backboard can be used if the thoracic or lumbar spine is involved. Additional trauma situations in which the backboard is used include injuries to the pelvis, hips, and lower extremities, and when multiple injuries in addition to spinal trauma are present. Most backboards are made from radiolucent materials. With assistance, one end of the backboard can be lifted in a cassette placed under the area of interest beneath the board. All AP projections from head to toe can be accomplished in this manner. Once the radiologist has evaluated the initial images, the backboard can be moved from under the patient for further projections. Regarding extremities, an inflation, or air splint is an inflatable plastic cuff that is slipped over the affected limb and inflated to provide stability for transport by the emergency team. These splints are readily radiolucent. Traction splints are designed for use on the lower extremities. Although traction splints often contain radiopaque materials, satisfactory initial images can be obtained with the splint in place. Most splints designed for use on the upper extremities are made from radiolucent materials. The anti-shock garment is a pair of inflatable trousers applied to the trauma patient. This garment is used in instances in which the patient has sustained trauma to the abdomen, pelvis, or lower extremities and internal hemorrhage is suggested. The trousers are radiolucent. Children as young as 3 or 4 years of age can be convinced to hold still without immobilization when communication is well done. This rapport is established with kindness, patience, honesty, and understanding. Get on their level by dropping to one knee to talk with the children face to face. When a parent or parents are involved, possibilities include having the parent accompany the child into the room to assist the radiologic and imaging sciences professional, having the parents wait outside the room during the procedure, or having a parent accompany the child but observing only. When departmental policy or the situation calls for parents to be present during the examination, the radiologic and imaging sciences professional absolutely must share the importance of cooperation and understanding with the parents. Rapport and communication should be the only techniques necessary for older children. One of the most effective, simple, inexpensive, and reliable methods of restraining or immobilizing a child is a mummy wrap. Although this method can be used on children 4 or 5 years of age, it is beneficial for children who are still too young to understand cooperation. This technique restrains most movement but is not satisfactory as a complete immobilization procedure. Restraint bands are still required, and the child should not be left alone, even for the amount of time needed to make a radiographic exposure. Commercial restraints usually take one of two forms: upright restraint devices or restraint boards. Two common useful upright restraint devices are the Pigostat and PediaPose or pediatric positioning chair. They can accommodate children up to approximately 3 to 4 years of age. The transparent Pigostat has a built-in, adjustable lead shield which provides gonadal protection, respiration phase indicators, and left and right markers. The PediaPoser pediatric positioning chair has an adjustable back and head tilt supports. It comes equipped with soft adjustable straps to help secure the child's arms and a chin strap to bring the chin up out of the chest. One disadvantage of the Pigostat is possible artifacts caused by the plastic sides, which can overlap the anatomic area of interest. Another type of commercial restraint device occasionally used in radiology departments is the restraint board, infant immobilizer. Even though several variations of restraint boards exist, all of them consist basically of a contour fitting pad, mold, or sponge with attached Velcro straps for securing the patient. A modification of the Velcro strap restraint board is the Octo-Stop board. The patient can be rotated 360 degrees into 8 different positions. The disadvantage of the regular restraint board and the octagonal framed version is size. Only infants and small children up to 1 year of age should be immobilized with these devices. A clever means of immobilizing the hands, fingers, feet, and toes of young patients is the use of a radiolucent plexiglass paddle. Applying gentle pressure to the affected area of interest aids the child in holding still. Tape should be used more as a reminder to the patient to hold still than as an absolute restraining device. When tape is used, it should be twisted where it comes in contact with the skin so that the non-adhesive side is in contact with the skin. Another technique to protect the skin is to place a gauze pad between the skin and the tape. A stockinette is a stretchable cotton fabric in the shape of a sleeve that is pulled over a fractured extremity before a plaster cast is applied. It comes in a roll and can be cut to any length. A stockinette is effective as a restraint when pulled over the upper or lower extremities of a child and secured with tape. This technique is good for immobilizing the upper limbs above and behind the child's head. In many instances, one of the greatest concerns of an older person is fear of falling. Allow for extra time during the examination so that the geriatric patient does not feel rushed or hurried. Keep the patient warm. The professional should cover the patient or offer extra blankets during a lengthy procedure. To enable the geriatric patient to cooperate easily and fully, a comfortable radiolucent pad should be placed on the table before the examination. A sponge or radiolucent pad beneath the patient's knees can greatly reduce strain on the patient's back and increase the patient's ability to cooperate. A pad might be objectionable to a radiologist because it may produce a slight artifact. Radiation therapy uses a variety of immobilization techniques to limit patient movement, ensuring proper administration of radiation. Cradle molds are created with a mix that is poured into a bag, then placed where patient immobilization is needed. VAC-LOC molds create custom immobilization through the use of bags filled with beans and vacuum suction. Thermoplastic head and neck masks are molded over the patient's face and neck during treatment planning to create a customized immobilization device. Occasionally, tape is used to aid in immobilization of claustrophobic patients.